Assalamualaikum warahmatullahi wabarakatuh. Thank you for the opportunity given to me to present my article with title Relationship Obesity in Pregnancy with Preeclampsia at the first Paris Van Java International Seminar 2020 event. This research was conducted by me, Evi Rinata, and Zahra Rosida Mustikaningrum at Sidoarjo General Hospital. The outline of this presentation consists of introduction, method, result, discussion, and conclusions. Okay, I will explain the introduction first. As we know, the preeclampsia is a complication in pregnancy and childbirth that begins to experience during pregnancy, reaches the age of 20 weeks with a marked increase in systolic and diastolic blood pressure, or blood pressure more than 140 and 19, and also accompanied by the discovery of proteinuria in pregnant women. And how about the obesity? Obesity is a condition with a body mass index or BMI more than 30. Worldwide, obesity cases has tripled since 1975, and in 2016, more than 1.9 billion adults were overweight, ages 18 years or older overweight, and more than 650 million are obese. The most likely impact of this case is the increased risk of cardiovascular disease. In 2008, the number of pregnant women who experience preeclampsia or eclampsia and obesity increases to 35.13%. The increase in the number of people suffering from preeclampsia is expected to be higher, along with the increase in cases of obesity throughout the world. This study is a retrospective study with an analytic survey design. The study was designed by collecting pre-pregnancy body weight and maternal height data by tracking the medical records of patients undergoing antenatal care at Sidoarjo General Hospital. The population is all pregnant women who have gestational age more than 20 weeks recorded in the medical record or register. Start from January until June 2018, as many as 258 mothers, and taken as many as 157 mothers. There is and the data collected is presented in the form of frequency tabulation and cross tabulations. Then analyze using computer software through chi-square test to see the relationship between obesity and the incidence of preeclampsia in pregnancy that can be related alpha 0.05. This research conducted from September 2018 until March 2019 in Sidoarjo Regional General Hospital. Recorded data from the medical record or register conducted from January until June 2018. The results of this study consist of age, gravidas status, history of large baby, history of twin pregnancy, polyhydramnion, hypertension, and also diabetes, the incidence of preeclampsia, and BMI status. Furthermore, the data will be presented in the form of frequency distribution table and cross tabulation. From the table 1, we know that the majority of mothers were in recommended age. Gravida status is multigravida, not experiencing with large baby history, not experiencing with twin pregnancy history, also not experiencing with polyhydramnion, not experiencing with hypertension, and the mother mostly in the third trimester and do not have a history of diabetes. In the table 2, The result of majority of mother, 54.14, were obese. Okay, this is obese. 54.14.1% were obese. And according to the theory, the criteria for obesity in the Asia Pacific population are divided into two, level 1 and level 2. And this is about the 85 pregnant women who were obese at the several level 1 and level 2. Obesity is a condition allow a mother woman to experience serious complications during pregnancy, especially if obesity lasts for long times. A mother can experience gestational diabetes, chronic hypertension or hypertension in pregnancy, disorder in the kidneys, and also heart disease. Okay, and the table 3, we know that near half of the pregnant women experience preeclampsia, 25.5%, and about the 40 mother who experienced preeclampsia was as follows: 13 mother who experienced superimposed preeclampsia and mild preeclampsia. And there were 14 mothers experiencing severe preeclampsia, and there is no HELP syndrome and eclampsia cases in this study. Preeclampsia are the stage before the occurrence of pregnancy poisoning is the incident of hypertension in pregnancy accompanied by the presence of proteinuria and edema after 20 weeks gestation or immediately after the labor occurs. Okay. The results show that there was a relationship between obesity in pregnant women and the incidence of preeclampsia. The research data shown in the table 4 shows that preeclampsia was more experienced by obese mother. Okay, preeclampsia was more experiences by obese mothers when compared to non-obese mothers, whereas the condition of not preeclampsia is more experiencing by mother who not obese when compared to obese mothers. Okay. The chi-square test result obtained p-value less than 0.001, which means that there was a relationship between obesity and the incidence of preeclampsia in pregnancy. Okay, in accordance with the theory that obesity that occur before pregnancy become a risk factor that can trigger several complications in pregnancy. If this condition is not maintained, we know that the possibility of the mother to experiencing related to disorder in the blood vessel system gets bigger and bigger, such as the possibility of experiencing hypertension, gestational diabetes, and many other things. And also, according to the Journal Epidemiology of Preeclampsia, obesity increases the risk of cardiovascular disease. In pregnant women who are obese, the risk of hypertension, and preeclampsia tends to increase. So it is important for women to maintain the pattern of nutrients intake during pregnancy so that obesity doesn't occur, because the risk of greater complication occurs in a woman who experience chronic obesity, and less likely in pregnant women who are obese as a result of pregnancy. Okay, so the conclusion of the research based on the result study is obtained conclusion as follow. Mother are obese, most mother are obese, most mother do not experience preeclampsia, and there is a relationship between obesity and the incidence of preeclampsia. The relationship so the need to increase intensive services or care in obese pregnant women so as not to develop preeclampsia or even eclampsia. This is the reference that we conducted to this study. Okay, thank you for listening. Have a nice, great day. Wassalamualaikum warahmatullahi wabarakatuh.